Did you just recently conduct a pregnancy test and it showed that you're positive, and then you went back to the hospital and then the doctor is telling you that you are not pregnant? Well, this video is for you. In today's video, I'm going to be discussing 8 reasons why you could have a false pregnancy test result. Welcome back to my YouTube channel. My name is Wogoyeshi Agnes and I film about medical related content and lifestyle. To all of my returning subscribers, thank you so much. And if you're watching this video for the first time, please do well to subscribe to this video so you could be getting notification when I drop my next video. Now the first reason is evaporation lines. Here you heard me, evaporation lines. Now these evaporation lines occur when you do not follow instructions of your pregnancy test kit. Now, most times pregnancy test kits tells you dip the test kit in your urine for like 30 seconds and read in 4 to 5 minutes. But the overzealous you want to look at the line very well to be sure that it's just one line or two lines, and then you leave it to stand for about 30 minutes to 1 hour, and then you're going back to check the test kit and you're seeing a very thin line, and in your head you're thinking is positive, whereas that line you're seeing is an evaporation line. When you leave a pregnancy test kit to stand for a very long time, the evaporation lines begin to occur. So it means that you are not pregnant. The second reason why you could have a false positive test result is medications. Now, there are some medications that have synthetic HCG in it. Now, this HCG, which is human chorionic gonadotropin hormone, is the hormone that is being tested in the laboratory to know if you're pregnant or not. Now, this medication already have synthetic HCG in them, and when you take these drugs, there is definitely going to be a metabolic breakdown of those drugs, and the end product will be passed down in your urine. And don't forget, this drug has HCG in them. So because you've ingested those drugs, there's a metabolic breakdown. This HCG would thereby be secreted in your urine. And when you do a pregnancy test, it will show that you are pregnant, but you are not. It will show a two lines, meaning that there's a HCG in your urine, but in the research, you are not pregnant. The third reason why you could have a positive pregnancy test result is medical condition. That's what I term it as, medical condition. Now, there are some rare medical conditions that can cause an increase in HCG in your bloodstream, which leads you to having HCG in your urine. Please don't forget that when the end product of our blood metabolism still end up in our urine. So when we have a rare blood disease or a rare condition that cause you to have increase of HCG in your bloodstream, the end product can also be secreted in your urine. Now, this rare condition includes rare ovarian cyst, kidney disease, and some cancer or tumor cells that can cause the development of placenta in you. And you know, placenta is an organ that houses the HCG. Now, if there are some cancer cells that cause the development of that placenta in your system, it can start leading to the presence of HCG in your urine. The fourth reason why you could have a false pregnancy test result is chemical pregnancy. Now, chemical pregnancy occurs when there is an implantation of an embryo in your uterus, but this embryo gets lost before it is being detected with an ultrasound scan. Now, you run a pregnancy test, it's showing positive. You went back to your doctor, and your doctor is saying that there is nothing like gestational sac in your uterus, which means that you're not pregnant. So that positive pregnancy test kit that you're holding that is showing you two lines, it could be that is a chemical pregnancy. Fourth one we're going to be looking at is molar pregnancy. Now, molar pregnancy occur, the fifth one rather, molar pregnancy occur when there is a development of an abnormal growth in the uterine cavity. Most time they, there could be a development of an abnormal placenta in the system, in the uterus. So it leads to you having HCG in your urine. Although I'm going to create another video giving a detailed explanation of what chemical and molar pregnancy is. The sixth one we're going to be looking at is ectopic pregnancy. Ectopic pregnancy is a condition that happens whereby a baby is formed outside of your uterus, and most times it could be in the fallopian tubes. So you can go for a scan and then they searched your womb and there is no baby in your womb and you're panicking. I did a pregnancy test, it's showing positive, and you're telling me that there's no baby in my womb. How manage? Just be patient and run a scan to know where the baby is. And most times this baby can be in different organs of your body. It could be in your liver, it could be in your fallopian tube, it could be in different organs. So that's why it's advisable to always seek medical counsel. I think the seventh one I'm going to be looking at is, I term it as recent pregnancy. Now, recent pregnancy in a situation whereby a woman just puts to birth, or a situation whereby you recently got an abortion or you recently had a miscarriage. It is possible for you to still have a positive pregnancy test result, but you are not pregnant, and that's because it takes about 6 weeks for HCG, which is human chorionic gonadotropin hormone, to shed out of your bloodstream. And when you run a pregnancy test, because of the presence of that HCG in your bloodstream, it will still give you a positive test result, but you are not pregnant. The last point I'm going to be dropping is, I term it as past pregnancy period. Past pregnancy period. This occurs mostly in menopausal or post-menopausal women. Now, there's usually increase of HCG in menopausal or post-menopausal women, which leads to a positive pregnancy test result. Now, normally HCG is usually housed in the placenta, but in this case, these HCG are produced by the pituitary gland, leading to a positive pregnancy test result. This brings me to the end of this video. If this video was very educative, please subscribe for more videos like this. And for everyone watching this for the first time, please do well to subscribe. For all my returning subscribers, thank you so much. I do not take this for granted. Leave a comment, and see you all in my next video. Bye.